rhabdomyosarcoma. You have embryonal, alveolar, pleomorphic, and spindle cell. This is not spindle cell, it's not pleomorphic, this is alveolar. Desmoid tumors result in a germline mutation of the APC gene.
What's up, everyone? Welcome back to the channel. My name is Cameron. I am a first-year medical student here in Blacksburg, Virginia, and this will be a day-in-the-life video of a medical student in second block, the MSK block, musculoskeletal block. We are halfway done. We're probably a little bit more than halfway done, and this is low-key my first official med school video in this block. So today is Wednesday. It is currently 5:30 a.m. I am about to knock out some Path SDLs, again, a student-derived learning. So I have all of these are articles that are going to be on this upcoming exam, which is Friday, and it is our final. And this is actually all that's going to be on it. So that class is just article-based. 10 pages per article, and ranges from different types of myopathies, bone tumors, muscular tumor or soft tissue tumors, metabolic myopathies, inflammatory myopathies, ankylosing spondylitis, gout, pseudo-gout, pseudo-gout. If you know what pseudo-gout is, that's a bonus for you. So it's a long one. It is a long one. I'm taking a different approach this time. I'm actually approaching as a student doctor. So what I do is in the morning around this time, I go over the overarching case. So for example, if we're doing bone tumors, it gives us a presentation here. So you know what, let me just turn it around this way. So if I was, let's say today I'm going over bone tumors, what I'll do is I'll read the case presentation. So a 13-year-old boy presents to the surgical clinic and then the clinical vignette. And then after that, I will just go through basically each one of these. So the diagnosis is osteosarcoma, because that's here. And then all of these I look at as just differentials. And then I just kind of fit every single one of those into this case, and I change the vignettes. And I just do that for every single one. So yeah, I'm gonna go through that for the next maybe hour. And then I have a crap ton of Anki to do. So then I'm gonna do Anki. Well, I only have 386 due today. And then after that, I will do my practice questions. I do have class today. That doesn't start at 9. However, I am helping the master's students. It was the same master program that I went through VCOM, or its partnership with VCOM through Bluefield University. I'm going to help them. They're taking their last anatomy exam and practical on Friday. So I'm going to help them set up. They wanted to try out a mock practical because we've experienced mock practicals here. I'm going to kind of like help them set up their practical in a way of how it would be tested, so they can just have a little bit more practice and kind of see where they are going into their exam on Friday. So we'll start that at 8. I will probably do that for maybe an hour and a half, depending on how long, and then I'll head to class. I'll probably go to class late. Let me go ahead and knock out these SDLs. I'm going to try to knock out all of those within an hour, and then I will regroup. And then I will probably present the case to you as if you were my attendant. No, I'm definitely not doing that. So yeah, let me knock these out, and then we'll go from there. I am running behind, but I am on my way to school. I just dropped Janai off. We had a little hiccup this morning. She decided to, I guess she couldn't put her shoes on, and she decided to just like run them over the sink. Mind you, these are Uggs with fur in them. And she was like, oh, let me just put my shoes in the sink, run some warm water on them, and then try to put them on. So she's trying to put on wet Uggs. Dad life. So yeah, that took a lot of time, but we're good. Everything is good. I just dropped her off. She's at school. I am on my way to school. All right, I will catch you guys when I get to the school. I'm heading over to the other building. So our class is there. I'm heading to this one. That's VCOM 2 to help set up their practical. And then I'm gonna head back. Oh yeah, also, we got our Patagucci's. I literally feel like I'm a medical student now. That's pretty legit. But yeah, I'll catch you guys when I am setting up. We're here. This is it. These are their models. Oh my god, I miss this low key. I don't remember this one. But yeah. So they're doing neuro. This one was probably by far my favorite anatomy section in the master's program, but I also remember being like dead tired, like exhausted from the semester. Yeah. So I'm just gonna help set it up. I'm gonna kind of set it up how the exam practical is set up for us. So yeah, that should be fun. That should be fun. Oh, I remember this one. That's a good one. What's up?
So,
Oh,
sorry, wait.
no, you're good. You're good. I just got here. So, have you ever been here? I'm vlogging, by the way, so that's why.
Sorry, no worries.
But have you ever been here?
I was
So
actually lost a little bit.
apparently, I didn't know they can close off the rooms.
Oh,
But like when we're in here for class,
yeah,
like these walls are taken down, so it's a massive like
yeah,
area. But now this makes sense
yeah,
for you guys to just have class here.
yeah.
I like it. I like it.
It is nice.
All right, we're gonna set up, and then I'll probably head to class after that. So I'll catch you guys. What's up? All right, so we are finished. We didn't finish the full setup, but I kind of laid everything out, and then just gave tips on how to write the question, and then make sure that the structures are visible as best as possible for the test takers to use to answer the question. So now I'm heading to class. It's 9 o'clock. Class started at 9, so I'm definitely going to be late. I'm walking back now to our main building. If you can see, I am in different clothes. I'm in my scrubs. I don't know if I've showed y'all these, but we have like the VCOM maroon scrub. Just finished doing some of my Anki. I did not finish all of them. I have 70 cards left for pathology, and then I'll be done with Anki. I am tired. This is my lunch. This is my lunch. Oh yeah, in the next like 15 minutes, well actually, I'm about to leave now. It is 1:30, so I'm about to head over to VCOM 2, the second class, or the second building. That's actually where I was this morning when I was setting up the setting up the mock practical for the master's student. We have our ultrasound lab there, so we're gonna go do ultrasound for an hour, and then we'll walk back to this building to do dissection, and that is 2 hours. I am exhausted. I am tired, but we will push through. Here's an update. Little update. I am 129 days in. And actually 129 days of med school, because this was day 1. So today is here. 129 days. Not too bad. Not too bad. All right. I'll catch you guys probably when I'm at the ultrasound lab.
Connor, take one too, please.
Because I like did something weird to the like to the screen. Now there.
Wiggle it again. So what's up? I'm back. I just finished studying for my pathology exam, which is Friday. I was doing some flashcard, like the last minute Anki flashcards, which wasn't too bad. I do feel ready for it. I do feel ready, but I am exhausted. I am now just winding down. Janetta just asked me if I can help her with her clinical skills. She has that coming up. I don't know when, but she has to like insert a Foley catheter and do something with medication. I think it's medication administration. So I'm going to be her standardized patient, and she's going to practice on me. I'm about to go do that. I will try to record it so you can kind of see what the in the life of a nursing student. Yeah, so I think she's ready now. So I'm about to head in there and do that. And then after that, I'm gonna just call it quits for tonight. Come in.
Hello, my name is Janetta and I will be your nurse today. I will be inserting a Foley cast provided by your doctor,
Who's the doctor?
Dr. Jones. Okay, hand sanitizer, clean my hands. I'm also going to provide you some privacy, okay? Have you ever had a Foley catheter done before?
No.
Okay, so I will be inserting this tube-like structure into your vaginal area, and if it was a penis, I would be inserting it into your penis.
Is that what you're inserting it into?
If you have a vagina, then I will insert it.
You gotta say it if I ain't got a vagina.
Well, typically I've been doing a woman. So
Well, what if you get a man?
I'll insert
Don't
it
even
into
say-
a man. I've
Yeah,
done
don't
it to
say
a woman.
vaginal.
I will insert
My
it
pronouns are he, him, and his.
table, and I will let the bed up.
You get on my nerves.
To my waistline, and then I will provide this towel. Okay, I want you to be nice and comfy.
I am.
Bed, and then do this leg the same way, and then keep your. There you go. Thank you so much. Okay, so I'm gonna need you to bear down and take a deep breath. And once I insert, you can exhale. Okay. So here we go. So I'm inserting. I see a flash of urine, and then I insert 2 to 3 more inches. Do it to make the little bubble, and then I'm going to tug to make sure it's in there good. Okay, it's in there good. All right, I'm gonna let your bed down into lowest position.
I need my call bell. And can you bring me a ginger ale?
All right.
Ginger ale, please.
Here's your call
And a
bell.
cup of ice.
Yes, sir. I will get to it. All right. And your tape.
And some graham crackers.
Oh,
Them-
yes.
Them graham crackers.
Mm-hmm. And now I'll bring your.
Where's my call bell?
It's right here, sir.
Okay.
Then I'm gonna bring your table over here.
Good.
And then we gotta do your medication administration.
All right. So I just finished, Janetta and I, we just finished her check off her skills, clinical skills thing. She did really good. She's going to do fine on the exam or her clinical skills check off. And that is pretty much it. Honestly, I have nothing else. I think I'm just going to go lay in the bed. Seriously. Watch some One Piece. I've definitely, Jeanette and I, we've been watching One Piece almost every night. So gonna watch some One Piece and then call it a night. So that is it for this video. Thank you so much for watching and tuning in. Please give this video a thumbs up, comment down in the comment section, and do not forget to hit that subscribe button. And until next time, I will see you in the next video. Peace.